with respect to the Granville Strip, I mean, I think there's steps we have to take everywhere, but one of the things that is particularly obviously frustrating for the overwhelming majority of people who are following public health guidelines and public health orders is to see that, because it was in public and because you could visually see what was going on, and some of the behavior was beyond the public health orders, simply disgraceful. But I would say this, that one of the order that Dr. Henry brought in last Monday with respect to private residences is important. Some of those events, which have seen a lot of transmission, and we review, as you know, every case, have occurred not with cameras around and not in the way we can visualize, but indoors, in private gatherings, sometimes relatively small gatherings. And so what we're asking people to do, especially in the season of gatherings and the season where it's colder and the season when the days are shorter, is to strictly limit that. And that's why the maximum of 6 is in the public health order, and that's why our advice to people is to avoid such gathering and stick within the home circumstances to the people who live in the home. This is one way, and we see this from the evidence that public health sees every day, that we can stop the transmission of COVID-19.
Thank you both for taking my question. This essentially is for Mr. Dix. You mentioned earlier that it's simply disgraceful what we saw happen on the Granville Strip in downtown Vancouver. What specifically are you prepared to do to bring these numbers down? Because it seems like a lot of people are ignoring orders. So what next if people are not following the orders that are already in place?
Well, thank you. Thanks for the question, Marcella. And I think the point I want to put into context here is that the orders that and what we've seen in recent weeks is the impact on COVID-19 transmission, principally in Fraser Health, of events that are held in private residences. And so we took action on that and gave a very clear change in what is the law with respect to such events last Monday. And so that is strong and clear action. And I think when you're strong and clear on these questions, I think people are anxious to follow that. There have been, from time to time, and we've dealt with them. I can recall events that occurred around the third week in March, when there appeared to be a lot of people at English Bay as we were dealing with some of the initial really very serious phase of the pandemic at that time. We've seen other situations develop over time that have been concerning to people, and we have to continue to respond to them, I think. But what we have to also focus on, and what we are focused on, is ensuring that workplaces are safe, ensuring that long-term care is safe, and that we can hopefully, by adding staff and supports, allow more visits in long-term care, that we take action where we see transmission occurring, and that is what you see going on. But look, all of us could see what was going on Granville Street. It was on TV, it was on social media, and I can imagine the frustration of the millions of British Columbians who are following the rules of that conduct. And it was a challenging situation for the Vancouver Police Department, and they've spoken about what occurred. But look, we have to. We're facing COVID-19 for a long time to come, for months and months and months and months and months and months and months to come. We're going to be dealing with COVID-19, and for us to do all the things that we want, to have children in school, to have surgeries performed, to have businesses operating, to have some normalcy in these extraordinary times in our lives, we need to follow public health guidance and public health advice. And whether it's Workplace BC or whether it's local law enforcement or bylaw officers, there is a role for enforcement, but we also need people, all of us, to be part of this effort. And that has been our goal from the beginning. I think that's one of the things that has been so effective by Dr. Henry and Dr. Gustafson and so many others in public health, and it's what we're going to continue to do. But obviously that, like all events, are going to be reviewed, and in light of the number of events facing us in the next little while, we're going to have to prepare for that as well.